Good morning. As the class 6 on alopecia, we will discuss about different kinds of alopecia. Alopecia भनेको चाहिँ it's the word means hair loss. So hair loss can be of different kind है. मान्छेले alopecia भन्ने बित्तिकै some or other kind of alopecia or a typical kind of alopecia बुझ्छ, but alopecia भन्ने चाहिँ broad umbrella term हो which includes every and all kind of hair loss. So first of all we need to know about the hair cycle. So hair को पनि cycle हुन्छ है. hair को cycle चाहिँ कस्तो हुन्छ भने anagen phase भनेर भन्छ hair मा. anagen भनेको growing phase हो. So growing phase मा the hair भने चाहिँ you should think of it as something that recycles from time to time. Okay, it's like a forest. So 3 to 5 years is this growth phase where एउटा hair को bulb बाट hair grow गर्छ अनि 3 to 5 years सम्म त्यो grow गरेकै हुन्छ. त्यसपछि एउटा फेज आउँछ जस्तै क्याटाजेन फेज भनेर भन्छ है. क्याटाजेन फेज भन्ने चाहिँ युजुअली इट लास्ट अराउन्ड 3 weeks भनेर पनि भन्छौँ हामी. सो समवेयर बिट्विन 10 days to 3 weeks सम्म लास्ट गर्छ. यसमा चाहिँ हेयर फलिकलको डेथ हुन्छ. बेसिकली दिस इज द टाइम वेयर द हेयर फलिकल श्रिङ्क्स, डिट्याचेस एन्ड बेसिकली इट डाइज. सो यो चाहिँ ग्रोथ फेज हो. फर्स्ट वाला एनाजेन भन्ने ग्रोथ फेज हो. त्यसपछि आउँछ क्याटाजेन, त्यो भनेको डेथ फेज हो. सो डेथ भएपछि चाहिँ टेलोजेन फेज भन्छ, जसलाई चाहिँ रेस्टिङ फेज भनेर पनि भन्छ. रेस्टिङ फेज भने चाहिँ लास्ट अराउन्ड 3 months. जुन हेयर डेड भएको हुन्छ नि, द डेड हेयर्स दे जस्ट किप लाइङ इन द्याट फलिकल. त्यो फलिकलमा बसिरहेको हुन्छ. अनि त्यसपछि एउटा एक्सोजेन फेज भन्ने आउँछ जुनमा चाहिँ सेड हुन्छ. सो बेसिकली जुन हेयर हाम्रो एज अ सेड भइरहेको छ नि, एज अ सेड भइरहेको हेयर चाहिँ अराउन्ड 3 महिना अगाडि नै डेड भइसकेको हुन्छ. त्यो डेड भइसकेपछि 3 महिना जस्तो रेस्टिङ फेजमा अर टेलोजेन फेजमा हेयर बस्छ र त्यसपछि मात्र झर्न थाल्छ. सो दिस इज भेरी इम्पोर्टेन्ट टु अन्डरस्ट्यान्ड दिस हेयर साइकल है. अनि एक्सोजेन मतलब त्यो झरिसकेको निक्लिसकेको जुन कपाल हुन्छ, त्यो निक्लिसके कपालको ठाउँबाट नयाँ कपाल अथवा फेरि नयाँ एनाजेन फेज न्यू हेयर चाहिँ ग्रो हुन थाल्छ. सो दिस इज लाइक अ साइकल. पहिला एनाजेन हुन्छ, कपाल ग्रो गरे गर्छ, त्यसपछि कपालको डेथ हुन्छ. त्यो डेथ भएको 2-3 महिनासम्म त्यो कपाल त्यो हेयर फलिकल भएकै ठाउँमा रेस्ट गरेर बस्छ. त्यो रेस्ट गरिसकेपछि आफ्टर सम टाइम इट स्टार्ट्स फलिङ. यो फलिङ फेज पनि 2-3 हप्तै 2-3 महिनै जान्छ र त्यसपछि फेरि त्यही हेयरको फलिकलबाट त्यही हेयरको बल्बबाट नयाँ हेयर ग्रो हुन थाल्छ. सो दिस इज अ साइक्लिकल थिङ. त्यसैले गर्दाखेरि अब कुनै पनि इन्सल्ट भयो है, फिजिकल अब त्यो बडीली इन्सल्ट भयो, जस्तो कसैलाई एकदम सिरियस केही डिजिज लाग्यो, समबडी ह्याड टु गेट एडमिटेड, सिभियर केही सिकनेस भयो भने चाहिँ त्यो बेलामा पनि धेरै हेयर एकैचोटि क्याटाजेन फेजमा अर डेथ फेज जान सक्छ. समटाइम्स स्ट्रेसको बेलामा लाइक व्हेन यु गाइज हेभ एक्जामिनेसन्स त्यस्तो भयो भने पनि मेनी इयर्स क्यान गो इन क्याटाजेन फेज बिकज अफ द स्ट्रेस थ्रु आउट द बडी. अल्सो कोही फ्यामिली मेम्बर्समा डेथ भयो, कुनै साइकोलोजिकल इस्युज भयो, सम रिलेसनसिप इस्युज, डेथ त्यस्तो भयो भने पनि त्यस्तो स्ट्रेसले गर्दाखेरि पनि एकैचोटि हेयर्सहरू क्याटाजेन अर डेथ फेजमा जान सक्छ. अनदर थिङ इज लाइक पिपल टेन टु डायट अलट होइन. डायट गर्दाखेरि एकचोटि 1-2 महिनामै 5-6 किलो 7 किलो जस्तो वेट, धेरै एग्रेसिभ वेट लस भयो, लाइक 5-6 monthsमा यु लुज लाइक 10 kgs अफ वेट. यस्तो एग्रेसिभ वेट लस भयो भने पनि स्ट्रेस हुन्छ बडीलाई है. त्यो कारणले गर्दा धेरै हेयर्स एकैचोटि यो क्याटाजेन अर रिग्रेसनमा जान थाल्छ. र यस्तो इभेन्ट भएको अराउन्ड 2-3 महिनासम्म चाहिँ कपाल झर्दैन, 2-3 महिना त्यसै रहन्छ र त्यसपछि चाहिँ अचानक धेरै कपाल झर्न थाल्छ होइन. So this becomes very important when we explain to our patients that whatever medicine we give, it does not stop the hair loss just from the next day, because जुन हेयर त्यहाँबाट डेथ भएर झर्नको लागि रेडी भएको हुन्छ त्यो 2-3 महिना अगाडि नै रेडी भइसकेको हुन्छ र त्यसपछि रेस्टिङ फेजमा बसिरहेको हुन्छ. त्यसपछि शेड हुन्छ and then it goes back to anagen phase. Okay, so this is a normal hair cycle. It is very important that we all understand this normal hair cycle. Also, whenever you see any shampoos or anything, people always there's this advertisement, they say like 90 days or you will get the return money. That advertisement is based also on this hair cycle, that most of the time your exogen, telogen, exogen phase around 3-4 months ko huncha. So people expect that in 90 days as such your telogen afai sakera jane huँदाखेरि these shampoos and these cosmetics, they capitalize the fact that 90 days को time or 3 months को time मा चाहिँ naturally नै यो चिलोजन सकिन हुँदा they use this also as advertisement that if the hair doesn't stop in 90 days we will return money or whatever it is, but natural course मा नै usually telogen चाहिँ 90 days मा सकिन्छ है. So you need to know this hair cycle को phase. So there are different types of alopecia or different types of hair loss. This is a broad heading of hair loss. एउटालाई चाहिँ हामी cicatricial hair loss भन्छौँ है. cicatricial hair loss भने चाहिँ scarring hair loss. स्कार भने जस्तो बर्नको स्कार भयो अथवा चोटपटक लागेको स्कार भयो अथवा आफै भित्रैबाट हुने डिजिजले पनि कहिलेकाहीँ चाहिँ स्कारिङ काइन्ड अफ एलोपेसिया गर्छ. स्कारिङ काइन्ड अफ एलोपेसिया मा चाहिँ के हुन्छ नि पेशेन्टलाई काउन्सिल गर्दाखेरि बिकम्स इम्पोर्टेन्ट द्याट वी टेल देम द्याट यदि स्कार भइसकेको छ भने युजुअली द हेयर विल नट ग्रो. अब बाहिरबाट एक्जोजिनस स्कार भएको छ जस्तो बर्नले भएको छ, एसिड इन्जुरीले भएको छ, ल्यासरेसन चोटपटक लागेर स्कार भएको छ, त्यस्तो खाले स्कारिङ एलोपेसिया हो भने चाहिँ हेयर क्यान you can do hair transplant or you can do other things and hairs can grow from such kind of scars. But यदि भित्रैबाट स्कार भएको छ कुनै डिजिज प्रोसेसले गर्दा जस्तो एसएलई मा डिएलई भन्ने लिजन्स हुन्छ, डिस्कोइड ल्युपस एरिथेमेटोसस भन्ने लिजन हुन्छ हैन. अब त्यस्तो डिएलई को कारण एलपीपी को कारण स्कार भएको छ भने in those kind of lesions the hair doesn't grow back. Okay, so patients need to be counseled in such cases. We also need to identify कि यो चाहिँ scarring loss हो, यसमा चाहिँ follicular unit damage भएर गएको छ, त्यसैले यसमा चाहिँ फेरि hair regrowth हुँदैन भनेर. Next type of alopecia is non-cicatricial alopecia. Non-cicatricial alopecia भने जसमा स्कार हुँदैन, जसमा probability of hair regrowth is there, a temporary kind of hair loss हुन्छ. यसको typical example चाहिँ alopecia areata हो है. alopecia areata मा सानो एरियाबाट हेयर लस भएको छ भने नन सिकेट्राइजिङ हो. एब्सोल्युटली चिल्लो देख्यो भने त्यसबाट चाहिँ हेयर फर्केर आउँछ है. So type of non-cicatricial alopecia मा like I said it is alopecia areata. telogen effluvium भने massive hair loss भएर कहिलेकाहीँ एकदम धेरै खालीपन पनि देखिन सक्छ, त्यसलाई telogen effluvium भन्छ. अर्को चाहिँ patterned hair loss जुन हामीले मोस्ट कमनली हामीले देख्ने भने चाहिँ एलोपेसिया एरियाटा हो. एलोपेसिया एरियाटा बच्चामा, यङ एजमा, ओल्ड एजमा, जुनै पनि एजमा हुने गर्छ. सो एलोपेसिया एरियाटा. अनि अर्को हामीले एकदम कमन देख्ने भने चाहिँ प्याटर्न हेयर लस, द्याट इज एन्ड्रोजेनेटिक एलोपेसिया इन मेल्स एन्ड फिमेल प्याटर्न हेयर लस इन फिमेल्स है. अब तिमीहरूले एन्ड्रोजेनेटिक एलोपेसिया त आजकल सुनि पनि रह होला, देखि पनि रह होला, इट्स भेरी कमन. बट फिमेल प्याटर्न हेयर लस पनि हुन्छ. फिमेल्समा पनि एक किसिमको एन्ड्रोजेनेटिक एलोपेसिया जस्तै हुन्छ, बट दे नेभर बिकम बल्ड, कम्प्लिट हेयर लस चाहिँ हुँदैन. तर एक्सेसिभ थिनिङ स्पेसली इन द फ्रन्टल एरिया अर मिड स्क्याल्प एरियामा एकदम एक्सेसिभ थिनिङ भएर फिमेल्समा पनि यस्तै एन्ड्रोजेनेटिक एलोपेसियाकै काउन्टर पार्ट फिमेल्समा पनि हुने गर्छ है. सो दिज आर टाइप्स अफ नन सिकेट्राइजिङ एलोपेसिया. And type of cicatrizing alopecia मा like I told there are two types. एउटा चाहिँ secondary कारणले गर्दा like burn, acid injury, infectious cause, trauma. These are secondary causes of cicatricial alopecia, and in those cases usually hair transplant can be done. Primary causes जुन भित्रैबाट हुने कज हुन्छ, सो डिएलई, लाइकेन प्लानस, यिनीहरूमा चाहिँ के पनि गर्न सकिँदैन. Those patients have to be told that it's very difficult for them to move ahead. Maybe they can use wigs, they can do other procedures, but transplant type of procedures say primary cicatricial alopecia ma chai garna sakenna. So cicatricial alopecia को definition भने चाहिँ कस्तो हुन्छ जस्तो यो एरिया भयो है. अब कहिलेकाहीँ एलोपेसिया एरियाटा पनि यस्तै देखिन्छ, तर क्लोजबाट गएर हेर्दाखेरि चाहिँ यहाँ कुनै पनि फलिकुलर युनिट हुँदैन र बायोप्सी गरेर हेर्दाखेरि पनि सबै हेयर फलिकुलर युनिट यसमा हुँदैन, पुरै हेयर फलिकुलर युनिटकै डिस्ट्रक्सन भइसकेको हुन्छ. सो दिज आर द टाइप्स अफ दिस इज एन एक्जाम्पल अफ cicatricial alopecia and these patients are very difficult to handle for us है. अब आयो एलोपेसिया एरियाटा. यो भने नन सिकेट्रिशियल एलोपेसिया हो. तिमीहरूले कतिपय अवस्थामा बढी देखि पनि राखेको हुन्छ होला. दिस इज प्याची एरियाज हुन्छ एन्ड देयर इज अ कम्प्लिट लस अफ हेयर इन दिस प्याची एरियाज. सो दिस इज एन एक्जाम्पल अफ alopecia areata. Sometimes it can happen all over the scalp. It can involve any hair bearing areas. केटा मान्छेमा beard मा हुन सक्छ, mustache मा हुन सक्छ, even body hairs को पनि loss हुन सक्छ, axillary hairs को loss हुन सक्छ, pubic hair को loss हुन सक्छ, eyebrows को lateral areas को or middle areas जहाँ पनि loss हुन सक्छ. So alopecia areata मा there is complete a loss of hair in that particular small area. नजिकैबाट गएर हेर्दाखेरि चाहिँ तर if you use a dermatoscope, you see here follicles को ostia भन्छ, opening चाहिँ present हुन्छ यिनीहरुमा है. And people give a very specific history कि 2-3 दिनमै एकदम सबै कपाल निस्केर गयो, खाली भएर गयो भनेर भन्छ. So alopecia areata looks like this. अनि प्याच टाइप हो है, यो टिपिकल प्याच टाइप हो. कोही कोही मान्छेको यस्तो पुरै पछाडिबाट ब्यान्ड लाइक लस हुन्छ, त्यसलाई सिसाको प्याटर्न भन्छ. This has a very bad prognosis. So this is another variant of alopecia areata. Okay, now this is another example where the whole scalp has gone. This person had hair like this, now he has lost complete hair. You can see कि उसको eyebrows, this eyebrows पनि loss भएको छ, hair पुरै loss भएको छ. पहिला यसको कपाल थियो पुरै eyebrows, hair, all facial hairs यो सबै loss भएको छ. So this is an example of alopecia totalis. Universalis भने चाहिँ full body as well as scalp as well as body को hair loss हुनुलाई चाहिँ alopecia universalis भन्छ. So these are different types: patch type, sisafo type, totalis type, universalis type. Right? Differential diagnosis. Sometimes children with tinea capitis also look like alopecia areata. अर्को भने trichotillomania हुन्छ है. Trichotillomania is where especially children or somebody pulls hair obsessively, आफ्नो कपाल आफै तानेको हुन्छ र त्यो तान्दा गरेर नै एउटा पर्टिकुलर एरियामा सबै हेयरको ड्यामेज भइसकेको हुन्छ. सो समटाइम्स एकदम एउटै ठाउँबाट कन्स्टेन्टली पुल गर्छ भने त्यो ठाउँ चिल्लो एलोपेसिया एरियाटा जस्तै देख्न सक्छ. So this is an example of it's a differential of alopecia areata, but this is actually trichotillomania. बच्चाहरुमा एकदम कमनली हुने गर्छ, त्यो बेक यङ एजको मान्छेहरुमा पनि हुने गर्छ. Patients usually deny the history that they pull hair, but वरिपरिको मान्छेले कहिलेकाहीँ चाहिँ भन्न सक्छ that they are constantly seen with their hand on their heads है. अर्को सिफिलिसमा हुने moth-eaten alopecia can also look like alopecia areata at sometimes. Nail findings are important in alopecia areata because the nails मा चाहिँ यस्तो pitted हुन्छ. This kind of pitting is also seen in psoriasis. It's also seen in lichen planus, but ekdam symmetric pitting is seen in case of alopecia areata. Okay, so another treatment of alopecia areata is basically we give them intralesional steroid दिने गर्छौं है. Intralesional एउटा दुईटा एप्रोच हुन सक्छ. So दुईटा एप्रोचमा एउटा चाहिँ wait and watch approach हुन्छ. So most of the time with children who have alopecia areata, if you do nothing, if you just wait for 6 months or 1 year, people tend to regain hair in that area. Sometimes people will say that I applied something very irritant, your onion juice or something like that, and it also causes hair to grow. Now what happens is alopecia areata ma kahilekai wait and watch केही पनि नगरे पनि hair regrowth हुने हुँदा चाहिँ sometimes just applying any remedy that actually just acts like a placebo, but for the patient it feels like it's because of that remedy that the hair grows. So wait and watch approach, एउटा single patch छ, दुईटा single patch छ भने चाहिँ wait and watch approach depends also. But if there are multiple patches present, if they are rapidly expand भइरहेको छ, एउटा प्याच दुईटा प्याच तीनटा प्याच देखिरहेको छ, यो पछाडीको एरियामा सिसाको प्याटर्न टाइपको छ, आइब्रोज गएको छ, मुस्टाच गएको छ, then in that case we need to treat them. And the most effective treatment for patients with alopecia areata is often topical or intralesional steroid. यो चाहिँ यो इन्ट्रालिजनल स्टेरोइड दिएको, इन्ट्रालिजनल ट्राइमसिनोलोन दिन्छौँ हामी. यसमा हामीले डाइल्युट गरेर दिन्छौँ. When people come to our postings, you will see how we give them. So we dilute and give intralesional steroids, which is given in the skin at जुन साइडमा एलोपेसिया एरियाटा भइरहेछ त्यही साइडमा दिन्छ. जस्तो आइब्रोजमा भइरहेछ भने आइब्रोजमा दिन्छ, बियर्डमा भइरहेछ भने बियर्डमा दिन्छ. So this is how we manage alopecia areata. त्यो बाहेक एकदम धेरै rapidly increasing multiple sites involved face, body, totalis, universalis भइरहेको छ भने चाहिँ कहिलेकाहीँ हामी oral steroids पनि चलाउने गर्छौं as a management of totalis or universalis alopecia areata. Unfortunately, they often tend to have recurrences, and that is very sad for these patients, but they often tend to have recurrence as well. Right? So something that helps in diagnosis of alopecia areata is exam एकदम सोध्ने भने चाहिँ यो exclamation sign भनेर भन्छ. So you can see that there is this small hair stubs present. यसलाई dermatoscopy मा पनि देख्छ, examination मा पनि देख्छ, and this is often asked in your examinations that what is the sign present in alopecia areata. So the sign present is called exclamation sign. This is a clinical sign seen on close visual examination or dermatoscopic examination. Then histopathology चाहिँ कहिलेकाहीँ अब एकदम क्लोज डिफरेन्सियल कहिलेकाहीँ टिनिया क्यापिटेससँग पनि छुट्याउन गाह्रो हुन्छ, ट्राइकोटिलोमेनियासँग पनि छुट्याउन गाह्रो हुन्छ, अथवा त्यो सिफिलिससँग पनि छुट्याउन गाह्रो हुन्छ. So usually alopecia areata is clinically diagnosed, but rarely if we need a histopathology. There's a classic appearance कि त्यो hair bulbs जुन हुन्छ, hair bulbs मा चाहिँ auto destruction of the hair bulbs seem to be happening. Okay, so this is a hair bulb present. You can see these blue cells like swarming around the hair bulbs. Is the swarming of these lymphocytes. These blue cells are lymphocytes. So swarming of these lymphocytes around the hair bulbs. This is known as swarm of bee appearance, and they tend to damage the hair bulbs. Right? So histopathology ma using swarm of bee appearance also. That is very typical of alopecia areata. So two things to remember: you have the swarm of bee appearance on histopathology, and other exclamation sign which is present on clinical examination. And etiopathogenesis of alopecia areata is that it is most of the patients will ask you kina bhairahach malai kina bhairahach, they are very curious to know malai kina bhairahach because it lasts for a long time. For some people euta patch auncha sakincha, but for some people patches keep coming, and though there is nothing systemically khasele kehi harm गर्ने होइन, but it appears people's looks, and when it appears people's looks, it appears people's confidence and how they see themselves and how they think of themselves. त्यसैले अब यहाँ eyebrows गइरहेछ, intermittently गइरहेछ भने it affects how people feel about themselves, and they want to know why it happens. Now why it happens ma, it is autoimmune in nature. You never know why it happens. Basically हाम्रो lymphocyte ले आफै autoimmune mechanism बाट हाम्रो hair bulbs that destroy गरिदिन्छ. The good thing about them is it is reversible in nature, it is non-cicatricial in nature, and these hair bulbs they tend to grow back. But हाम्रो lymphocyte ले आफै autoimmune way मा हाम्रो आफ्नै hair bulb लाई damage गरेर चाहिँ is the main reason why alopecia areata occurs. And this is why steroid intralesionally dida, it works as a management of alopecia areata, because when you give steroid at a particular space, हामीले त्यो ठाउँको immune local immunity लाई down गर्छौं. Local immunity down भएपछि जुन त्यो hyperactive immune activate भएर hair को loss भइरहेको थियो त्यो चाहिँ stop हुन्छ process, and hair tends to regrow. So, but because this is autoimmune in nature, often autoimmune diseases are associated with one another, like thyroiditis, autoimmune thyroiditis, alopecia areata, vitiligo, where autoimmune destruction of melanocytes occur. Also, diabetes mellitus, where autoimmune damage of the pancreatic beta cells occur. So these things are related with each other. त्यसैले हामी जहिले पनि alopecia areata को patient आउँदाखेरि चाहिँ एक न एकचोटि thyroid को examination, thyroid function test, or just ask them history of if they have diabetes mellitus. We tend to ask this because often they come together. The autoimmune diseases they present together, that can happen. So there is a probability that such things may also be happening. अनि this is it. अनि अर्को चीज के छ भने यो हामीले म्यानेजमेन्ट गर्दा एलोपेसिया एरियाटाको चाहिँ कहिलेकाहीँ एलोपेसिया एरियाटाको म्यानेजमेन्ट पछि जुन नयाँ हेयर आउँछ नि, यहाँ यु क्यान सी सम हेयर आर न्यू हेयर्स, यो अघिल्लो कारण regrowth भइरहेको हेयर हो है. Sometimes when the new hair grows, they are white in color. Now there's no exact reason why they are white in color, but the new hairs that grow are sometimes white in color, and eventually with time they become the normal black colored hairs मा develop भएर जान्छ है. So next we deal with, and next was the management. I told you oral steroid pani huncha. So next is patterned hair loss. So patterned hair loss ma there is androgenetic alopecia in males, and there is female patterned hair loss or female androgenetic alopecia which is seen in females, right? अब यो जुन grade यो चाहिँ Norwood classification of alopecia areata भनेर भन्छ. So this is males after age of 20-21 you start having some slight temporal regression अलिकति चाहिँ आउन थाल्छ. This is because of the masculine hormones. This is considered absolutely normal. त्यसैले अलिकति यो grade 1 Norwood or even up to grade 2 where you lose almost up till here, so that sort of a loss is considered normal. Okay, so when males are in their 15, 16, 17 years मा चाहिँ female को जस्तै you have something like this kind of a hairline. यो hairline भन्छ है यसलाई. So you have this kind of hairline. So as you age, you tend to have temporal regression. So some amount of temporal regression, Norwood grade 1 up to maybe Norwood grade 2, a little bit up till here, that is considered within normal limits. Okay, so normal masculine hormones, the study of 2021, you tend to increase in those hormone levels. यो सबै hormonal कारणले गर्दाखेरि अलिकति केही grade 1 grade 2 सम्मको चाहिँ normally हुन्छ androgenetic alopecia. Now when it starts going for grade 3, त्यो भने अलिक अझै पछाडी यहाँसम्म जान थाल्छ, or grade 3 vertex, when there is यसलाई vertex भन्छ, when there is vertex area मा पनि thinning आउन थाल्छ, then people may require some form of treatment. So this is grade 1 where it's considered mild, almost normal. Grade 2 can also be called almost normal, but if it is properly grade 2, you might start needing treatment, going for treatment. But and then you have grade 3, 4, 5, 6, and then you have grade 7. Grade 7 मा पछाडिपट्टि एकदम सानो band मात्र बाँकी रहन्छ. Okay, and this is the normal kind of androgenetic alopecia. There is a reverse kind of androgenetic alopecia also, in which मान्छेको यो band पनि नरहन सक्छ. Like usually you see in grade 7 that there is a small band of hair remaining. Some people, some families might say there is a reverse androgenetic alopecia also, where even this band of hair may not be there. Okay, now when the term itself is androgenetic alopecia, andro is in males, genetic as usually it has a genetic predilection, and alopecia as in hair loss. Okay, so most of the people will say, okay, there's nobody in my family, my father doesn't have it, my brother doesn't have it, my uncles don't have it, so how is this genetic in nature? So the thing is, androgenetic alopecia ko jun major locus, मतलब it's obviously male female mother father दुईटैबाट derived हुन्छ, तर जुन एउटा major locus हुन्छ त्यो चाहिँ X chromosome मा बसेको हुन्छ. So even in males the X chromosome comes from the mother side, so often maternal inheritance is also of significant value. Maternal when obviously females don't have complete alopecia, but maternal side of the family, that is mamaहरुको तिर कस्तो थियो अथवा maternal grandparents को तिर कस्तो थियो. And often when we talk of genetic, we think only of our parents or maybe of our paternal grandparents. But when it comes to genes, it's often in the great great grandparents or the great great grand aunt, great great grand uncle. Genes for like it's just 2-3 generation, but for us they are people from very long time ago, right? So androgenetic alopecia, usually there's always some kind of genetic history present. Genetics is usually present from maternal side, paternal side, both sides. Stronger maternal influence on androgenetic alopecia ma, and this is how it presents, right? Pictures so yeah, now it can start at any age. Normally people say ki people in our earlier generation they started at 40. But now we are seeing that even 19, 20, 21, 25 years old males also are presenting with androgenetic alopecia. So अघिल्लो generation भन्दा चाहिँ अलिक अगाडि नै presentation भएको छ. Now this is female pattern hair loss. हामीले कतिले देखा होला, some females are very less hair in the frontal section. यो section मा एकदम कम hair हुन्छ. So this is a female pattern hair loss or female version of androgenetic alopecia. They will never lose hair. यहाँबाट completely cover कहिले पनि जाँदैन. They will never become bald, but they have this very very sparse hair present in the frontal area. So this is a female pattern hair loss or female androgenetic alopecia. Here you can see here center your portion में एकदम कम hair छ हैन. So यसमा पनि strong genetic history. So often momsहरुमा such females have it in their moms, in their aunts, and often these kind of female pattern hair loss is present in females who have some or other kind of ovarian disorder, some abnormal menstrual cycle. Sometimes it's just genetic, but sometimes it is often associated with PCOD sort of disorders, polycystic ovarian disease, where they have excessive facial hair, aligati weight gain, loss of hair on the scalp, presence of type 2 diabetes mellitus type of metabolic syndrome type of features. So these patients have female pattern hair loss. Okay, another interesting thing with androgenetic alopecia that I suddenly remembered is that most of the times, most of the boys they tend to ask, guys they tend to ask, why we'll never lose hair here, right? So now that is because of June Ambro, one of the drugs that is used in treatment of androgenetic alopecia is finasteride, and it is a alpha dehydrogenase blocker also, alpha DHT blocker also. So the hairs in the frontal part of the head, it is not that these males who have androgenetic alopecia have more testosterone or more active alpha hormone level body. They don't have a hormonal problem, but it is just that the hairs in the front part of the head, in the vertex part of the head, in males are more susceptible to this hormone, more susceptible to testosterone. And in the effect of testosterone say on hair is that if there is like more, if the hair roots have more receptors for testosterone, the testosterone binds to these hair roots, त्यसपछि त्यो hair roots सानो हुँदै जान्छ, पातलो हुँदै जान्छ, and ultimately they stop regrowing. Okay, so it is not that they have hormonal issues, but it is just that by some genetic mechanism, the roots of those hairs in the front part or in the vertex part of their head, they have more receptors for testosterone. Now more receptors for active form of testosterone is present in these people. Okay, this कारणले गर्दाखेरि चाहिँ hair loss happens in these areas, but यो एरियामा भएको हेयरमा चाहिँ टेस्टोस्टेरोनको जुन त्यो रिसेप्टर्स कमै हुने गर्छ, नर्मली टेस्टोस्टेरोनको रिसेप्टर धेरै हुँदैन, त्यसैले गर्दा this part of the head is spared. This is particularly the reason why यहाँको चाहिँ स्पेयरिङ हुन्छ, यहाँको इन्भल्भमेन्ट हुन्छ. अनि हेयर ट्रान्सप्लान्ट गर्दाखेरि हामी जब यहाँको हेयर रुट्सलाई यहाँ अगाडि ट्रान्सप्लान्ट गर्छौँ, these hair roots they carry the same quality that तिनीहरूको जुन रिसेप्टर यहाँ अगाडि गएपछि बढ्ने हुँदैन, they have the same less number of receptors, so they tend to grow properly here also है. रिडिस्ट्रिब्युट गर्दाखेरि यहाँबाट यहाँ लाँदाखेरि त्यो रुट्समा चाहिँ टेस्टोस्टेरोन रिसेप्टर्स चाहिँ यहाँकोमा कम भएको कारणले गर्दाखेरि तिनीहरूमा फेरि हर्मोनको इफेक्ट चाहिँ आउँदैन. So it's because of the effect of male hormones on the hair roots, and it's not that the hormonal problem is there, it's just that due to some genetic mechanism the hair roots are more susceptible to the hormones in people who have androgenetic alopecia. In female androgenetic alopecia or female pattern hair loss, it is not just because of testosterone, it is because of many multifactorial ones. So it is not that these females also have increased male hormones or some other problem like that, but there are multiple factors. Male pattern hair loss is so clear cut, easy to understand say in a female pattern hair loss, right? But there is a multifactorial of which this PCOD, metabolic syndrome, all these have a role to play in case of female pattern hair loss. Now, treatment in case of both male pattern hair loss and female pattern hair losses, we give topical minoxidil. It is available 2%, 5%, and 10%. Males ma say 5% is licensed, twice daily use. Females ma people used to use only 2%, but now 5% once daily use is also licensed in case of females. But in females we say once daily, in males we say twice daily. Right? And 10% minoxidil is not licensed, but sometimes some people like to use. Not much disadvantage. Minoxidil, the exact mechanism of how it causes hair growth is not well understood, but then it is considered that it affects the vascularity, cutaneous vascularity effect versus scalp, and it somehow increases the blood supply and then it causes the hairs to grow. It's not like भएको कपालमा त हैन जुन लस भएर गएको हुन्छ, जुन एन्ड्रोजेनेटिक एलोपेसिया कारण पातलो भएको कपाल या लस भएको कपाल लास्ट 2-3 years मा, even those can be reversed with uses of topical minoxidil. But one has to understand that minoxidil is something that androgenetic alopecia bhairaheko patient huncha, it's a long term therapy for them. They have to keep using it to prevent the hair loss. There is not much disadvantage to keep problem हुँदैन. कोही मान्छेलाई चाहिँ minoxidil allergy गराउँछ, but it's very rare. त्यो skin मै allergy हुन्छ, not like they'll develop a whole body rash or something. Skin मै allergy हुन्छ. For those people, of course, they can't use minoxidil, but otherwise there's not much disadvantage. It's just something that you have to use morning and evening. One should take it as using toothpaste or like face wash or something that one uses daily. त्यस्तै हिसाबमा युज गर्यो भने चाहिँ यसले एन्ड्रोजेनेटिक एलोपेसियाको प्रोसेसलाई स्टप पनि गर्छ, टु सम एक्सटेन्ट रिभर्स पनि गर्छ. तर यसको एक्सन चाहिँ युजुअली यतापट्टि सेन्ट्रल भर्टेक्स र क्राउन एरिया, मिडल स्क्याल्प एरियामा बढी हुन्छ. फ्रन्ट एरिया जहाँ राम्रैसँग कपाल गइसकेको छ त्यसमा चाहिँ टपिकल मिनोक्सिडिलको लाइक so effect मात्र हुन्छ. But whenever you guys prescribe or you guys use minoxidil, in males it should be used twice daily, and in case of females it should be used once daily. Okay. Finasteride we use 1 mg. It is often given regular or sometimes given alternate day or sometimes given twice weekly. Finasteride is given for a short period of time. Long period ma दिँदैन 6 months 1 year दिन्छौँ त्यसपछि रिभ्यू गर्छौँ and then again it is added. Now with finasteride 5 mg dose ma there were people used to have a lot of problem of erectile dysfunction or some sexual problem, but usually when we give 1 mg regular or alternate day or twice weekly dose ma say such problems are not much seen. And usually people who become aware of such problem, who think too much about it, they are the ones who suffer. But normally if you give to patients who don't bother much, we don't see them complaining on their own about these problems. So it's not known ki kati yo problem say psychological ho athwa patients just become more conscious and they start feeling that way, and how much of it is because of the drug. But normally alternate day or twice weekly is considered very safe. The next option in patients with androgenetic alopecia is doing hair transplant. So when we do hair transplant, we transplant follicular units. This is how each hair follicular units look like. This is what gets transplanted. So in normal माथि skin भन्दा माथि चाहिँ यो hair देखिरहेको हुन्छ अनि यो चाहिँ normally hair को roots हो है. So normally एउटा follicular unit में sometimes it has 1 root, sometimes it has 2 roots, sometimes it has got 3 roots. So these are the follicular units that we transplant. And so this is how it looks. यो पछाडिबाट चाहिँ जहाँ हेयर डेन्स हुन्छ यहाँबाट हामी हेयर्स निकाल्छौँ, follicular युनिटहरु एक्सट्र्याक्ट गर्छौँ. त्यसपछि यो अगाडिको एरियामा चाहिँ हामी follicular युनिट्सहरु ट्रान्सप्लान्ट गर्छौँ or reposition गर्छौँ है. So normally how do we expect them to grow? Like now hair transplant have got it, this is day 0. So in 3 months you have some amount of hair growth. In 6 months you have a little more dense hair growth. So it takes about a year, one whole year for results of hair transplant to become visible. Okay, so but this is how it occurs. पछाडिबाट ग्रो गराउने हो जहाँबाट हामीले हेयरको रुट्स निकाले हुन्छ त्यहाँ चाहिँ अब त्यो हेयर follicular units are gone from those areas, but they grow in the frontal area. So it's sort of redistribution. पछाडि जहाँ धेरै dense कपाल हुन्छ त्यहाँबाट निकालेर अगाडिपट्टि redistribute गरेको. Okay. So these are just some pictures of cicatricial alopecia. You don't need to know about them in detail, but you need to just for pictographically recognize garnako लागि, right? So this is an example of DLE, discoid lupus erythematosus. Typically you will see a central pink area. This pink area is surrounded by a hyperpigmented area. यो pink area में absolutely lots of follicular ostia. के पनि हुँदैन follicular ostia मा. Sometimes you can see like, and these are very atrophic area हुन्छ, dilated follicular orifices हुन्छ, यहाँ देखिरहेको छ dilated orifices हुन्छ, कुनै कुनै ठाउँमा keratin plugs पनि हुन्छ अनि follicular ostia चाहिँ present हुँदैन. यो खाले alopecia मा चाहिँ hair regrowth हुँदैन. And these kind of alopecia you cannot do hair transplant also. यो आफै endogenous way बाट primary cicatricial alopecia or discoid lupus erythematosus, so it is not amenable to doing hair transplant because anything you transplant here in this area, the body will destroy those hairs also, right? So this is another example. You say lichen planopilaris. So lichen planus के hair मा हुने form हो. So hair follicle को root में यो purple area देख्छौं. You know that lichen planus is purplish in color. So you can see these purple patches at the base of the hair. बीच-बीचमा hair completely lost भएको छ. जति hair छ त्यसको root मा पनि यो purple plaques छ, अलिकति scaling छ. So this is an example of lichen planopilaris. In this also the hair does not regrow back. So we can stop the process. दबाई दिन सक्छौं, stop the process गर्न सक्छौं. अरु hair जानबाट जोगाउन सक्छौं, तर गइसकेको एरियामा चाहिँ regrowth गराउन it's impossible, right? This is another which also looks like alopecia areata जस्तै देखिन्छ, तर यसलाई चाहिँ Pseudopelade of Brocq भन्छ. यसको अर्को नाम चाहिँ footsteps on snow पनि भन्छ, because यो एउटा patch यहाँ गरेर it's considered to be like footsteps on snow. Okay, so even in this case of alopecia, cicatricial alopecia हो यो, यसमा पनि hair regrowth हुँदैन. These are very difficult to take care conditions. Patients feel really bad, and the only options in these cases are either to wear a wig or maybe put biofilaments. Those kind of options are there. Mostly wig is considered an option for patients who have cicatricial alopecia, right? अर्को भने चाहिँ acne keloidalis nuchae हो. यो पनि एक प्रकारको alopecia sort of hair loss हुने ठाउँ हो यो चाहिँ नर्मली मेल्समा देखिन्छ फिमेल्समा पनि देखिन्छ बट युजुअली इन मेल्स पहिला चाहिँ यो नेप अफ द नेकमा सानो सानो एक्ने जस्तै लिजन्स आउँछ नर्मली जो मान्छेहरूले यो कलर्ड सर्ट लगाइरहेको हुन्छ यसले कन्सटेन्ट इरिटेसन गरेर सुरु हुन्छ त्यसपछि यो सानो सानो पहिला त फोका फोका जस्तो आउँछ देन दे स्टार्ट यु नो लाइक बिकमिङ थिकर एन्ड अल्टिमेटली एकदम सिभियर केसमा चाहिँ कहिलेकाहीँ यस्तो किलोइड जस्तै गरी डेभलप हुन्छ सो वी हेभ टु गिभ इन्ट्रालिसनल स्टेरोइड्स इन देन so this is another example of hair loss. So this is called acne keloidalis nuchae. For you people, what you guys need to know is that there is a kind of alopecia where hair grows, where hair doesn't grow. When it grows, it is considered non-cicatricial. Where it grows, it's considered non-cicatricial. Where it does not grow, it is considered cicatricial. Right? Non-cicatricial सबैभन्दा important हाम्रो लागि practically important भने चाहिँ alopecia areata हो. Then you guys need to know a little bit about androgenetic alopecia. बाँकी cicatricial hair loss को बारेमा चाहिँ ultimately DLE त SLE क्लासमा पनि पढ्छौ lichen planus lichen planopilaris, lichen planus report. So you just need to know their names, okay? That these are the different types of alopecia, and this is how we deal with them. So alopecia areata is important practically as well as from exam point of view. Thank you. Any questions from your side?